Cystic fibrosis, by definition, is a genetic disease affecting mostly the pancreas and the respiratory system. Cystic fibrosis can also be referred to as 65 roses because it is easier for the diagnosed children to pronounce. 30,000 children and adults in the United States, 70,000 worldwide, have cystic fibrosis, and more than 70% of the patients that are diagnosed by age 2. Only about 45% of the cystic fibrosis patient population is age 18 or older. The predicted age of survival for a person with cystic fibrosis is only in their late 30s. Cystic fibrosis, because it is genetic, is impossible to prevent, but early detection can lead to longer lives of the patient.
Alright, so my name is Tara Burke, and I've been living with cystic fibrosis for 18 years now. I was diagnosed when I was 14 months old. My parents took me to the doctor's office because I kept catching a bunch of colds and I was sick. I wasn't gaining any weight and I was eating all the time. So when I was diagnosed, they were shocked because we've never heard of anybody else in my family having cystic fibrosis. So eventually, over time, a lot of mucus builds up in your lungs, and they eventually stop working or they get scarred. And in your digestive system, there's a lack of pancreatic enzymes, so you don't digest your food and get all the nutrients out of them. So to treat the digestive system part, I take a lot of enzymes each day, and it changes depending on each person and each scenario. But I'm taking about 4 with a meal, 3 with a snack. Every time I eat something, I have to take enzymes. For the respiratory part, there are a lot of different treatments. A lot of inhaled meds to prevent infection and keep the lungs working. People with cystic fibrosis grow bacteria in their lungs that normal people fight off without any problems, but people with cystic fibrosis have to take extra meds to get rid of them. I've done a few study drugs and trials on different meds. I tried a vest one time, which was a big vest you put on that would blow up and shake, and it would just try to loosen things up in your lungs so that you're able to breathe easier. So I found out about a year ago, I was told that I was going to need a double lung transplant. I started to get sick. I've been in and out of the hospital about 5 times in the past year. My lung functions dropped down to about 18%. I was on oxygen full time, very little energy. I wasn't able to do much throughout the day. Just taking a shower was a lot of effort and exhausting. At night, I had to sleep with a BiPAP machine on, which is a big mask, kind of like an astronaut mask. And it makes sure that your lungs keep breathing overnight and that you're breathing deep enough to expel carbon monoxide from your lungs and just keep you breathing and your oxygen levels up. So 3 months ago, got my double lung transplant. I fortunately had a very good surgery. I was in surgery for about 8 hours, I think. And as soon as they took the ventilator breathing tube out, I was completely amazed at how much I could breathe differently. I started getting more energy back because I wasn't wasting energy breathing. Before my transplant, in order to keep my weight up, I would have had to eat over 3,500 calories a day because I was wasting so much energy on just breathing. After surgery, I'm now able to eat like a normal person and go out and do whatever I want. I started a physio routine because you lose a lot of muscle and you lose muscle quick when you're sitting around doing nothing. I was doing breathing exercises to start working my diaphragm because I was not able to take a deep breath before. Just on Monday when I had a clinic appointment, my lung functions are up to about 90% now compared to 18% just 3 months ago. So that's a really big improvement. The weight is coming on, which is great. Probably the only girl out there who's happy to gain weight. And yeah, for the first 3 months after transplant, I was on 1 inhaled med. I just stopped that on Monday, so now I'm taking a fair amount of pills. Some of them are anti-rejection meds and immunosuppressant meds, so they keep me from fighting off the lungs, because otherwise my body would reject them because it's something foreign put inside of you. So right now it's probably close to about 30 or 40 pills a day. But other than that, I have full energy. I'm able to go walking and running and, do whatever I want now, which is exciting, because before, like I said, like to walk up the stairs was an effort, or to shower or anything. So now it's a completely different life for me.